Hey, Dr. Heather here, and in this video, I'm going to talk about low back pain and how I use regenerative techniques to relieve pain and restore function to the lumbar spine. Low back pain is still the most common cause in the United States for disability and urgent care visits. Do you or someone you love suffer from back pain? Has your back pain caused you to lose sleep or work and kept you from activities you enjoy? Have you tried steroid injections or other treatments without long-term relief? What if there was a way to relieve your back pain without surgery for an extended period of time, like 1 to 5 years, and in doing so, actually improve and heal the structural supportive tissues in your back rather than just covering up the pain? Wouldn't that be amazing? Well, let me tell you about the treatment I did for my patient, Anne. So Anne had chronic low back pain and sacroiliac pain, which had been going on for about 5 years. She thinks it started after she slipped on the ice up north and fell, but back then it was a mild aching pain that would just come and go. Then a couple years later, she simply bent over to pick up a piece of paper on the ground and felt a sharp, severe pain across her low back at the belt line. She tried many treatments, including good old-fashioned rest. She also tried PT and went to a chiropractor, which all helped to some degree. But the pain was always there at some level and would worsen after activities like golf or pickleball, which she loved. She could play a game of pickleball without much pain, but by that same night and the whole next day, she had to stay lying down most of the day due to her back pain. She would occasionally have pain that radiated into her buttocks and thighs, but typically it stayed in the lumbar and sacral spine. She had also had an epidural steroid injection, which provided a month of relief, but she did not like the side effects from the steroid. So I examined her and obtained a lumbar MRI. So on physical exam, she would feel mild aching with prolonged sitting and stronger pain when she transitioned from sitting to standing. She was very guarded with bending forward or backward, and she had really tight muscles in her whole low back region. She did not have pain going down her leg or weakness in her legs, but she was very tender along the belt line and along her sacroiliac joints, which are in the sacral area just below the belt line. So her MRI showed that she had a disc protrusion at L4-5 and at L5-S1 with mild to moderate stenosis, but nothing severe. She also had a spondylolisthesis at L5-S1, so that's a medical term for when one vertebrae is slipped off of the one above or below it. I'll show you what I mean in a moment. And the small joints in her back, called the facet joints, were inflamed. She was tired of this pain cycle and with her back, and it started to affect her quality of life, since now she was avoiding physical activity. She'd stopped playing pickleball, golf, and stopped exercising completely a year ago and had lost much of her strength. So I was able to offer Anne a treatment plan that included the M-Sculpt to strengthen her core and her buttock muscles, K-laser treatments, the peptides BPC-157 and thymosin beta-4, and a cellular procedure to her back that included both autologous regenerative cells along with PRP. So what is autologous cellular therapy? Well, by definition, autologous cells are stem cells obtained from one's own body. Of all stem cell therapy types, autologous harvesting involves the least risk. What are stem cells? Well, stem cells are cells that can differentiate into other types of cells, meaning they can change from being a stem cell into being a muscle cell, or becoming a ligament cell or a bone cell. They can also divide in self-renewal to produce more of the same type of stem cells. So in regenerative medicine, we only work with adult stem cells, which are found in various tissues of fully developed humans. In adult organisms, stem cells and progenitor cells, which are like stem cells but lying dormant in all the tissues of our body, they act as a repair system for the body, replenishing adult tissues. Stem cells can differentiate into all the specialized cells, ectoderm, endoderm, and mesoderm, which then go on to become all of our tissues, but also maintain the normal turnover of regenerative organs, such as blood, skin, or intestinal tissues. So the three sources of autologous adult stem cells in regenerative medicine come from bone marrow, adipose or fat tissue, and blood, but only a very few of us know how to isolate the cells from blood. Of all stem cell therapy types, autologous harvesting involves the least risk. By definition, autologous cells are obtained from one's own body, just as one may bank his or her own blood for elective surgical procedures. So there are times when I would go into the disc itself with my procedures, but a recent study done on this very subject showed that out of 5,000 cases of low back pain with a herniated disc present, when all the structures around the disc and the supportive structures were treated, 4,850 of those patients had their back pain resolved without actually injecting anything into the disc itself. So this is what I elected to do in Anne's case. So let me show you. I'm going to go over to my anatomy model here. So the lumbar spine is a complicated structure that is held in proper alignment with ligaments, fascia, muscle, and joints. This is the lumbar spine. This is the sacral spine. So you can see here, we can kind of turn it so you can see this is all ligaments and connective tissue. This is where the discs are here. And this is where Anne's problem was. It was at L4-5 and L5 to S1 and all the way through into her sacroiliac joints down here. This was her pain region. The worst of it was right here. So we have discs between the vertebrae, which I just showed you, which sometimes become displaced. But research has shown us that while discs can be out of place, and they can be the cause of back pain, over 80% of the time, the out-of-place disc is not the main pain generator, especially back pain that stays in the back and does not shoot down the leg. So often there's a combination of factors which led up to the back pain. These ligaments in particular, these guys, let me see if I can get a little closer. These ligaments, I have to come back out so you can see how all these ligaments that strap through across here, super, super, super important. These guys right here, the interspinous ligaments, the supraspinous ligament. We have these ligaments across the transverse process. We have the iliolumbar ligament, super important in stabilizing. And these ligaments have a very limited blood supply, which makes it harder to heal them when they get injured. But they're full of lots of little nerve endings in which can cause pain. So this pain that specifically comes from the ligaments has its own name. It's called enthesopathy. So as we go here, let me show you, when the ligaments are not fail to keep the back stable and in correct alignment, the muscles are called into duty to help stabilize. So you can see here, these are the deep layers of muscle. You can see muscles that make up the core really deep in here. These deep muscles that attach right to the ligaments and to the bone underneath. And then we layer back out big, thick muscles through here. Look at how dense and thick these are. These become the stabilizers when the ligaments aren't holding things into place anymore. And look at all the different directions allow us to keep our body strong and move in different directions. This big quadratus lumborum, this is the one that tends to be really sensitive and get big knots in it. It's a very strong muscle and a very big muscle. I'm going to take the muscles away again so you can look back at the structures underneath. So when we're treating all of those structures. So when those muscles get called into duty, it often presents as muscle spasm and tightness, which can lead to a buildup of lactic acid in the muscle and more pain, muscle pain on top of other pain. So by injecting a regenerative capable substance, such as the autologous cellular preparation I used in Anne's case, into all of these structures, the ligaments especially, the tendon attachments, and the joints and the capsules, then these specific areas, the body can regenerate new ligament and tendon in the lumbar spine. So what I have found is that our best results come from treating the lumbar spine as a region. So the whole area down into the sacrum as well. Not just treating one level or one part of the back, but each person needs to have a complete workup done to determine the best procedure for their pain. For Anne, about 2 weeks after her procedure, she noticed her back pain significantly decreased. At 6 weeks, she was back to playing both golf and pickleball, being careful, and with her stronger core and gluteal muscles from the M-Sculpt, she was able to have better form and performance. So in summary, we've discussed the regenerative options for low back pain, we discussed what an autologous cellular procedure entails, and I shared with you my patient Anne's story, who went from chronic low back pain back to an active life without back pain and without surgery. So treating back pain with autologous cellular therapy is not for everyone, but if you think we might be able to help you or someone you love with back pain, contact us. And for more information about regenerative procedures for low back pain, please go to drheather.net/backpain. That's drheather.net/backpain. Thanks for joining me today. I hope you found this information useful. We just want to help you live your best life ever.